I first want to start out by asking this question. If you've ever taken a supplement and have felt all of a sudden numb, lack of interest, all of a sudden your motivation started to decrease, you also started to feel more fatigued and tired, because that's something that happened to me years ago. And it's something that I've noticed happens a lot with adults with ADHD, with this very particular supplement that's so popular that I have to question, is it something good for people with ADHD? And so I was doing one of my trials that I do with a lot of different supplements when I want to try something out, and I'll test it for 30 days. And this particular supplement is ashwagandha, very popular, but I was experiencing these exact symptoms where I was starting to feel just emotionally numb, not interested in things. I started to feel really fatigued, and I just didn't have that drive. And I was like, what is going on here? I also was not the only one that was experiencing this. I noticed online a lot of people were talking about this, and it's a symptom known as anhedonia, and something that's very common amongst the ADHD community when they would be taking ashwagandha. But there wasn't very much research on this. In fact, there's still not really much research on this of why this is happening. And then I started noticing when I would see patients that came to see me and they would tell me about this, and I would have to look into of why this was happening and how to start getting them off of ashwagandha. And so I dived in deeper to see what was the case. One of the big things that I did notice is that ashwagandha can be a very effective tool for lowering cortisol. However, what I have noticed, even for myself with ADHD and a lot of adults with ADHD, is that we tend to be really burnt out. And cortisol tends to be really low, especially when you do test for it. And sure enough, my cortisol levels were low. And the patients that I tested for that had these symptoms while taking ashwagandha also had low cortisol. And so as I removed that, all of a sudden those symptoms started to dissipate. But it doesn't stop there. When I dived in deeper, I found that ashwagandha can inhibit certain catecholamines, things like dopamine, epinephrine, norepinephrine. And if you're someone that has low dopamine and norepinephrine to begin with, this might not be a very good thing. In fact, this is why you can feel less motivated, feel a little bit more sluggish and fatigued, because it's inhibiting that. But on the flip side, what I would notice is that the very select few patients that I saw that had spiked cortisol or spiked levels of dopamine, norepinephrine, epinephrine, they would be really stressed, very high intensity, very restless. And then I would use something like ashwagandha and noticed that did help improve things, because that's what the research shows. And so it can be an effective tool, but from my experience, probably about 80 to 90% of the people that I've seen over the years with ADHD, especially adults, tend to be more this inattentive burnout state. And they're not this hyperactive ADHD type. In fact, even for me, growing up, I was kind of a mix where I had inattentive and also hyperactive. But as an adult, I have more of the inattentive type of ADHD. And this is why ashwagandha was just something that was more of a poison, and it was not good for me. And it wasn't good for my patients that had the same type of symptoms, but also the same similar lab test that I had. And so this is why we have to be really careful about what we do take. And ashwagandha literally can be a poison to you if it is doing the opposite of what you want it to do. And so in this case, since it's known to blunt things like dopamine, epinephrine, norepinephrine, and cortisol, and you're low in that, not a good choice of using something like ashwagandha. Now, the other case that I would say of when to probably use it, if you feel like it does benefit you, is use it at nighttime. And the reason why I use it at night, like before you go to bed, is because cortisol needs to be low at night. That's how you're able to fall asleep. And so that's when I would say it's a good time to take it. But if you are the hyperactive ADHD type and you tend to be very high stress, agitated, then ashwagandha can be beneficial to you. But this is where I would want to look at testing to see, okay, if that's the case, where is your level spiking throughout the day? And this is what helps me effectively know to treat my patient of what time of the day they should take ashwagandha to lower those levels so that they can feel that peace and calm state. But there's always balance in everything. You don't want to do too much of something, and you certainly don't want to be taking something that if you're already low in it and it also lowers it as well, like something like ashwagandha. So I'm really curious. I do want to know, leave it in the comments if you've experienced this with taking ashwagandha, and especially if you have ADHD as an adult, if you have anhedonia symptoms of the loss of interest, emotional numbness, fatigue, reduced motivation. Let me know, because I'm really curious, because I really do think this is something that we got to be careful with, and it can be a poison for a lot of us, but it can benefit a select few of people that are in that category that I just explained. Now, when it comes to taking supplements, especially for ADHD, it is very complex. It's very difficult to really know what works best. And so you should watch this video next, where I talk about my 3-step process and system of how to really truly eliminate your ADHD symptoms and identify the root causes to helping you out. So watch this video next.